on breast health. It's Jennifer Shepard, your Integrative Manual Physical Therapy, and this topic is very, very near and dear to my heart, and it's been a lot of self-experimentation, self-exploration that I'm just starting to bring into the clinic. And so many of us who pursue and excel in our particular niches. And with regard to niche, I am a whole person therapist, so I really don't niche. I niche in whole person, from head to toe, inside and out, because I can't not compartmentalize or see one thing. I see one thing, but I see it as integrated at the whole. And when we address the wholeness of the human organism, body, mind, soul, structural, functional, emotional, when we address those most important needs, and we methodically help our patient, guide our patient through referrals out, nutrition, exercise, and the manual therapy that we do, we can help unburden a system and help restore it to a place where that body can be more efficient in its daily functionings, all the millions of things it does every day to keep you alive, moving, breathing, all amazing things. Your body's amazing. But back to breast health. So my mom had a small tumor, which honestly didn't surprise me. I love her so much. I lost her Alzheimer's in 2023. And this is not a story about Alzheimer's, but it's part of her journey and is significant in many ways. She was diagnosed with a small tumor, which sometimes I'm like, it's just a matter of time, just because of, the foods that we eat, the toxins we're exposed to, genetic sensitivities, sedentary lifestyle. There's many, many things that set us up to not have optimal health in our cells that can contribute to proliferation of cancer cells. I'm not a cancer expert. I never will be. I'm not at all. This is just my experience, my mom's experience, and experience that I'm sharing I'm exploring with patients in my clinic. So I've always had dense breasts. I didn't really realize it until I started to get mammograms at like age 40. And I believe my very first mammogram, I go in and all of a sudden they're like, oh my gosh, we see something. You can't go home yet. So they walk me to the back room. I was scared to death. Actually, I lost one of my really best friends to breast cancer, 13 months from diagnosis to death. So scared to death. Oh my gosh, they found something. I think this is even before my mom was diagnosed. And so they take you to that back room and you're like scared to death, like, oh my gosh. So they do an ultrasound, they're looking, and I'm looking at the ultrasound, and like I see these big dark spots, and they're like, oh no, the dark spots are good, those are cysts, fluid-filled lymph sacs. So they look with the ultrasound, and like, I don't know what's healthy, what's not, I don't know how to read an ultrasound. And then they're like, okay, you're fine, that's great, you're okay. I'm like, whew, that was really scary. So all of that workup to say, you're fine, which again, all of the stress on the nervous system is not healthy for inflammation, not healthy for our cells. So I think I go in for another mammogram or something, and they're like, your breasts are so dense, you should do an MRI. I'm like, all right, fine. They had to put dye in, which, knowing now, like, whew, there's more chemicals in my body. So I go in for this breast MRI, and my breast came out fine, but they're like, oh, we see something here in your mediastinum. We need to do a CT scan and see what that is. I'm like, oh my gosh, what is it in my chest? What could be there? So here's this worry, what is this? So I go in for my CT scan, they're like, oh, it's fine, there's nothing. So fast forward, I'm getting mammograms kind of here and there, they're clear. I didn't really know much about breast health at the time. I'm just doing my thing, figuring life out. I moved to Ohio shortly after my mom died. I go in for a mammogram, which I should have never gone in right after, such a traumatic event, because again, the concept of inflammation, heck yeah, I was inflamed. I was drinking a ton. I was self-medicating with wine so much, actually from divorce and moving, and then through my mom's Alzheimer's and death and dying. I definitely was not taking good care of myself and my liver, in my body, with alcohol. So, and then just the stress and strain of my mom dying and that whole process. So absolutely, I was in a state of inflammation. So of course I tipped a mammogram, and here I'm in Ohio with new practitioners, and oh no, there's something in your mammogram. You need to get it looked at. And my PCP is calling every day. You need to get this looked at. You need to get this looked at. And I just said, hold on, hang on. This is not my first rodeo. This happens all the time. I'm always tipping mammograms. And we go through all of this panic and all of this worry, and then it's fine. And I just intuitively knew, like in my heart of hearts, I'm like, I'm really not that concerned. Like, I know my breast well. I work with the tissues, I feel them. let's wait. Because a couple things, like, how much is this going to cost me? I have shitty insurance and have such expensive deductibles that how much is going to cost me, number one. Number two, the time to do it, and again, just all this panic and worry for them to say, no, you're fine. So that really started to get me to think there's got to be a better way for me to, number one, have my breast health looked at, assessed, and taken care of. And then number two, what do I need to do to ensure that, yes, these dense breasts that are vulnerable to perhaps, tumors, or tumors are harder to see or a bit more vulnerable to develop cancer, how can I take better care of them to try to reduce my risk of cancer or tumor? And again, there are people who do everything, right? They are super healthy. They've got chilled lifestyles. They're taking care of their nervous systems, and they still get hit with cancer and they die. So it's not that it's always preventable, and I don't want to say that, but the more, because it just happens, and we don't understand, like, why does it happen when people do take care of themselves and they still end up with nasty, icky cancer somewhere and they die within like 4 months or 13 months? Like, that still is just mystery unknown. Don't get that. And sometimes it just happens. But for the vast majority, a lot of the common factors that set us up for a state of imbalance or a state of lack of health in our cells that sets up this substrate or foundation to tip cells into cancer can be addressed and looked at. I need to wrap this right up, but I'll come back to it. The concepts that we're exploring in the clinic are the concepts of lymphatic flow throughout the body, the concept of tissue mobility throughout the breast, which is super important for lymph drainage, healthy arterial blood coming in, kind of dirty, cleaning out the dirty blood, venous drainage. Again, detoxification, mechanical detoxification of the breast tissue. Again, toxins love to hang out in fat cells. We've got fatty, dense breasts. That's where toxins like to stay. So the more we can help flush out, improve those flow channels, improve flushing out of the breast tissue. Super, super important. It's an area that I don't think many people are looking at. Health of the liver, how we metabolize our hormones, especially our estrogen. Again, the healthier we can keep our liver, the better we can have hormone balance and health. Often estrogen, there can be an imbalance, or there can be different metabolites of estrogen that are all dependent on pathways within the liver, and they can be healthy forms of estrogen, and they can also be unhealthy forms of estrogen. So it's important to look at those metabolic pathways of estrogen metabolism and excretion and balance. And a lot of that comes down to also, right, here's what we eat, here's your genetic sensitivities, and then of course our autonomic nervous system, our stress levels. So there's many facets of our health, of our bodies, mind, souls, that we can look at to support our systems to be a bit more healthier, a bit more proactive into how can we keep our breast, not just our breast, of course, right? Because we don't want to just compartmentalize, but mammograms, ultrasounds, thermography. Breast health is such a big deal, and breast cancer is such a big deal. And again, so much money is thrown at mammograms as prevention, but it's really not prevention, because it's just looking at how's the health of your breast. It's not addressing how do we help our breasts be healthier. So stay tuned. I have a great case study that I'm starting to put together with actually some beautiful diagnostic reports where you can see changes pre and post. Super exciting. So stay tuned, and we'll share that soon.